with our chapters and folks around the state, are trying to get Virginia to expand healthcare. And as part of that, the first plan was meeting with our key senators and delegates to talk with them about this issue and why we need their support. As you know, when we tried to get a meeting with Senator Norment, he couldn't find time for us between September and January. And so if we can't talk to him directly, the next thing we need to do is be outside and convey a message. And so we really are here today to pray for the state, to pray for people without health care, and to pray and importune with Senator
Billion. Believe that people need to be assisted in getting an opportunity that will make a difference in their lives.
Carolyn O'Connor, I'm from the United Methodist Church, and I believe that if people don't get health care that they need in a timely fashion, they'll just ignore their medical problems until they're on death's door and then come to the emergency room. And it costs us more money in the long run not to fund health care.
Right.
I'm Anthony Flood, Church of God in Christ. I believe that health care is essential and it's a right.
Hi, I'm Herb Reinaldson, United Methodist. People get sick.
Yes.
Diane Langhorse, St. Martin's Episcopal Church, saves parents of children's lives.
I came because of Chris Llewellyn and the interfaith email from Charles, and it's stupid not to.
Jane Ferguson, Williamsburg Unitarian Universalist. It makes sense morally, medically, economically.
Sue Gennaro, none of the above, and 30% of the kids in Williamsburg qualify for free and reduced lunches at school, and living in poverty, they need to be covered, and their parents need to be covered.
Les Good, retired Methodist minister, and I just believe the state ought to have as a priority the needs of its citizens.
Bob Kidd, Williamsburg Baptist. I speak only for me, but for me it's a moral imperative.
Mary Jo Bennett, Williamsburg United Methodist, and everyone should have health care. And in the long run, if we take care of people in the beginning, their lives will be much more healthy.
Penny Kidd, Williamsburg Baptist Church. Everyone needs health care.
Larry Ventus, Williamsburg Unitarian Universalist. There's no reason not to accept this expanded Medicaid funding other than obstructionism.
Fellow Unitarian Universalist, and I think this is the first step towards universal health care.
Karen Eversole, Unitarian Universalist. It's the right thing to do.
Osama Aisi, a Muslim, a part of the Virginia Beach community, and every human being deserves health care.
Karen Cameron, I'm director of Virginia Interfaith Center's healthcare program. I believe that healthy people make a healthy society.
Sue Swadley, Williamsburg United Methodist Church. Health care is not a privilege, it's a right.
Daniel Wilson, Williamsburg Baptist Church. Again, speaking for myself, she said what I was going to say.
Sorry.
Travis Harris, Black Lives Matter. I didn't have health care until I was 25.
Les Solomon, Unitarian Universalists. It says it all. I'm standing on the side of love, plus everything else has been said.
Dr. Chris Llewellyn, Williamsburg Unitarian Universalist. Health care is a basic human right.
Rob Whitehead, New Zion Baptist Church, and again, it's the right thing to do.
Darnell Jones, New Zion Baptist Church, it's needed.
Joe Posey, St. Luke's United Methodist in Yorktown, and it's a moral obligation.
Charles Swadley, I've already introduced myself. It's a moral imperative that affects the entire state of Virginia, especially Southwest Virginia, where there's virtually no safety net in dental and health care for 9 counties. For many other places, for all the people around us who work in the service industry and make part-time jobs with no benefits. Healthcare is the right thing to do.